Welcome everyone. We'll start in just a moment. People are coming in now. Welcome everybody. It's nice to see so many different types of names from all over the world joining. We'll give it another 30 seconds or so and see how many more want to come in, and then we'll kick off. Okay, I think we'll get started. There may be a few more coming in the next couple of minutes, but we'll begin with some introductions here. Welcome everyone to this English language application guidance session for the European Microfinance Award 2021 on inclusive finance and healthcare. My name's Sam Mendelsohn. I'm financial inclusion specialist at the European Microfinance platform and part of the Microfinance Award team that oversees the whole process, from the research of the topic to putting together materials, designing the application forms and the evaluation models, and then managing the evaluation and selection committees, as well as the comms. This team is effectively led by my colleague Gabriella, who you can see as well. She's senior microfinance expert at EMFP, and you almost all certainly know her name because she's the lead point of contact on the award with applicants for many years now. And because she's running the French and the Spanish versions of this session over the next 2 days, we thought we'd give her a little respite and that I'd lead this English language one. We also have with us the two other members of the core part of the award team. That's Daniel Rosas and Joanna Afonso, and they can jump in a bit later on when we get into the questions too. So today, I'm only going to speak for a few minutes up top to give a brief presentation of the award, and then we're going to be able to have questions from any of or all of you on the award process. This can be done in a couple of ways. You can either use the Q&A. Sure, everyone's very familiar with how Zoom works by now. Please put questions in there if you have them, and make them as specific as possible, or you can raise your hand. Because this is not an unmanageable number of people, we don't have hundreds on, then we should be able to, if you raise your hand, unmute you, and you can ask directly if you prefer to do it that way. Keep an eye on the chat. Gabriella will be posting some links to materials and documents that might help you, some of which you perhaps have seen already, like the concept note and the guidelines, but keep an eye on there. So a little background to the award, to those of you less familiar. It's co-organized by the European Microfinance Platform, the Luxembourg Ministry, and Infine, which is the Luxembourgish Inclusive Finance Network. It's been going since 2006, and each year attracts applications from organizations that are active in financial services around the world, which are innovating in a particular area of financial inclusion. So each year the topic is different, and recent ones have included education, housing, technology savings, climate change resilience, post-crisis context, food security, and others. There are many goals, but I would say there are two primary goals for this award. And one is to reward excellence, to to look through the dizzying array of different initiatives that go on in a field and identify those that are just doing so well, but also to collect and then disseminate the most relevant practices for replication by others. So it's a leveraging process. We try and leverage this excellence so that others can benefit from it. There are many benefits to the award. The first is the highlight one, which you know, there's a €100,000 award for the winner and €10,000 for each of the two runners-up. But that's only part of it. There is an annual publication, which used to be called the European Dialogue Series, and which is published each year. And this pulls together the case studies of the 10 semi-finalists and introduces the topic, but really tries to synthesize what are the factors for success that we have all learned over the course of the year that this particular award will run. This is widely read, widely disseminated, and very valuable for those 10 semi-finalists. There are also offsite sessions, panels and whatnot that e-MFP organized that have involved semi-finalists and finalists in the past, follow-up interviews, introductions. But e-MFP has an incredibly broad network in the sector of investors, donors, raters, policymakers, researchers, consultants. And there are a number of ways that we are able to introduce to make linkages between people who, organizations that progress far in this process with the sector at large. And we can anecdotally say that this is maybe the biggest value to those that proceed deep into the process, is the exposure they get to new stakeholders. So let's move on a little bit to the this year's topic. Can I have the next slide, Gabrielle? Thanks. So why is health important? And the concept note, which you hopefully have seen through social media or the invitations to this award, and the link is being put in the chat, makes clear that health more than ever is the most important thing for people, and especially for low-income communities. And that the poor and the financially excluded, the people that our sector serves, not only need access to healthcare, but clearly the ability to pay for it, particularly as they disproportionately live in countries without world-class universal healthcare systems. The problem is huge. The WHO says that almost 1 billion people incurred catastrophic out-of-pocket health spending in 2015 that exceeded 10% of their household budget. Over 200 million exceeded 25% of their budget. 150 million people suffer severe financial hardship each year from out-of-pocket health expenditures. 100 million are pushed into poverty. This is an enormous problem. And it's got worse during the COVID pandemic as well. And the problem's twofold, because on the one hand, the poor need to access and afford even basic or day-to-day healthcare, which may be insurmountable. And secondly, for those who are successfully treated and even recover from an injury, they may then carry the financial burden of the health shock for years later and down generations. And so financial health expenditures are one of the main reasons that clients borrow from MFIs, even if they may claim that it's for something else. And health issues are a real driver of repayment problems as well. You're almost all practitioners here. Surely this will ring some bells already. And so what the award this year aims to highlight is initiatives that show how the financial inclusion sector can help the poor and the excluded access quality and affordable healthcare, and help them plan out their day-to-day medical spending and smooth out the health-related financial shocks that can come with that. We recognize there's an enormous range of ways that the sector can and does approach this most difficult challenge. It can include dedicated financial products like insurance or education schemes, partnering with healthcare providers to lower costs. And you'll see some examples of this in the concept note. But that's not a prescriptive list. We have put together the concept note just to map out at a high level the landscape, and are very much looking forward to then being able to delve down and see what are the specifics that you and others are doing. So let's move a little bit to eligibility criteria now. And in the chat, Gabrielle is posting the link to the guidelines, which hopefully you will have seen already. The different types of organizations are eligible, and that can include financial service providers, MFIs of different types that directly provide or facilitate access to healthcare. It can include non-financial organizations that do facilitate healthcare access via partnerships or other relationships with FSPs. The applicant organization has to be based in a and operate in a relevant country. There's a list called the DAC Development Assistance Committee list, and that will be posted as well. But that link is also in the supporting materials you've seen to make sure that that it's eligible in terms of country. And finally, the applicant will need to provide audited financial statements. Moreover, the products and services that are being put forward as part of the initiative have to have been fully operational for at least 1 year. This doesn't mean that the products have to have been offered in every single branch and location for all of that time. And so additional products and services that were introduced in the last year are also welcome. But the main part of the health initiative has to have been operational for more than a year. Let's move on quickly to go through the structure of the process. It's in 2 rounds. What opened last week or the week before was round 1. And this is the one currently open. In this, you will be expected to give an overview of your institution as a whole so that the judges have a better understanding of the institution. Present briefly the healthcare program. That includes context, the target audience, their healthcare needs. Give a detailed description of the program, who are the partners, if any, that you work with, what are the financial or non-financial products that are part of it, and how they respond to the specific needs of that target sector. There are some opportunities for indicators on the outreach of your program, and then the audited financial statements for the past 3 fiscal years. The aim of this, so up until 3 years ago, the award was one stage, one very comprehensive form. And then 3 years ago, we split it into this, which is a shorter first round. And then those that are successful in this, maybe a certain number will be invited to round 2, which asks for details of the healthcare program in greater detail and some other supporting documentation and a letter of support from an e-MFP member, etc. In round 2, there's a pre-selection phase, a selection phase, and then finally it goes to a high jury, and that winner. So the selection committee, which is in October, will choose the 10 up to 10 semi-finalists and 3 finalists. The high jury will choose the winner from the 3 finalists, and that will be announced during Microfinance Week in November. And after each phase, applicants are informed if they have made it to the next one. So a last reminder that to have a look at the materials that have been sent around, the guidelines and the concept note. We think they're pretty good, but we decided to run these sessions because we're sure that there may be questions that might be specific to your case that aren't covered in this, and we are at your disposal to help in any way we can. So with that, now we'll open it to the floor and have a look at what have we got in any Q&A? None yet. And would anyone like to raise their hand? Here we are. Right, this is from Kelly, who says that Promuher is composed of a group of multiple microfinance institutions in multiple countries that also offer health programs. Can Promuher apply multiple times for the different countries, or would one application for all regional programs be preferred? If we apply highlighting one country's experience, can we use the funding to expand programs in another country? good question. Gabriela, why don't you take that?
Yeah, I would say, I mean, both options are possible. If you would like to apply with for all regional programs. The only thing is that take into account that the applicant needs to be based on on an eligible country. So I think ProMujer as such headquarters, if they are not sure where they are, just make sure you fulfill all the eligibility criteria. If we apply highlighting, the money usually goes to the applicant, in the sense that if it's a concrete FSP that applies, the money would go to that FSP. I know there can be some arrangements made. They are done on a case-by-case basis. When we get to that point in time, we will see what's feasible. I know in the past, sometimes the funding, the award, the prize has been used, yes, in the network of which the FSP is part. So this has been done in the past. It's on a case-by-case basis. Hope it's clear.
Kelly, do you have any follow-up? If so, we can unmute you if you want to ask anything, or no? Okay. Thank you, that was helpful. Great.
Okay, no problem.
Great. Anybody else would like to ask some questions, either about the evaluation process or the application form? Hopefully, you've had a chance to look. I mean, by all means, raise your hand and then you can speak. That might be easier than typing on the Q&A. We can also, if necessary, share on screen the first application form to go through it if there are questions. Right. From Sheila Guanzon asks, I've looked at the application and it requires 3 years of financial statements. For the year 2020, can it just be draft as the AFS is not yet available?
Yes.
Yes.
Yeah, that's a clear yes, no problem. I think it's actually explained in the application form. For year 2020 can be draft, and we will follow up throughout the process. And yeah, usually sometimes applicants send us the audited version in September. It's not a problem. What we try to have is actually the audited version by the time we get to the selection committee meeting in end of September, and for sure, yeah, high jury. But it's fine to apply with the draft for the time being. And even you can, if you don't have even the draft ready, you can apply. There is a space in the application form to indicate when do you expect to have the draft. So no worries for 2020. We understand that sometimes it's a bit early. You're welcome, Sheila. You can raise your hand if it's...
if that's, if you'd prefer to ask over audio, that's no problem. Perhaps our little, here we are. So I'm afraid your name's in Cyrillic and I can't pronounce that, forgive me. But can we please have any sample about how to apply? Do you mean an example of a previous applicant, or what the form looks like? I think you mean sort of some example text. Not really. I don't think.
Sorry, I can.
No, go ahead. Go ahead.
Yeah. So I mean, there is no sample on how to apply, in the sense that you need to. The application form explains, each and every question has an explanation on the information you need to provide. So if you go in the system, you have there the application form, and actually there is the option to download the application form in Word in case you want to split it with your colleagues, share the work, and then one person uploads it in the system. We don't share applications from previous years. The information you provide is confidential, and it's and we keep it private. Of course, we use it for communications with your permission, but only that information that can be used. You can tell us, listen, this is confidential, this cannot be used. So no, we don't share examples, but the application form explains quite in detail what do we expect for each question. But if we haven't answered your question, go and let me know. But I think the application form is quite clear. Yeah. Okay, Sudan, yes, it's eligible to apply.
I have this application in the website. Yes. Are you asking, it gets filled in online rather than say in a form which gets emailed back? The answer is yes. But Gabriela, do you want to explain how the system works?
Yeah, sure. So maybe I can quickly share my screen if you want. And let me quickly, so do you see my screen? Do you see this is how
Yes.
the system will look for you. So here you have the instructions on what is expected in round one, the documents that are available. And here is where I say you have the Word version of the application form that you can download to work offline. Note that you can modify your responses at any time before submitting. So, well, now I already have started an application. When you go in, you will need to click on Start Application, and you will give the name for your application. So you go in the system, and this is the application form. You type your organization name here, and then you have the different tabs that ask you for the information. So it's what Sam explained. This is general info about the contact person, who is who will be the touch point for us. Then you have component one is the part that provides the overview of your institution. So we want to have a clear picture of the institution that is applying. So you have a qualitative part and a quantitative part. Then component two, those three tabs refer to the healthcare program. So as Sam said, context, description of the program, and its products and outreach. And then component three is the three audited financial statements. And as I say here, you have this option in case you are not able to you provide the non-audited or draft, or even if you don't provide any financial statements, you can explain here. And final tab, just a few of confirmation and consent issues. So, I mean, it needs to be submitted via the system. So please don't forget, once you are done to submit the applications, once it's submitted, it can be changed in general. So be sure that the information that is in is the one you want. If there is any issue you submit without wanting to submit and it's a mistake, contact me in the email that you have available at the very beginning. You have our contact email here. Anything you have with the application, please don't hesitate to be in touch. As I say, if you submit by mistake, contact me and we can put it back into application status. Yeah, and while you are working on it, while it's not submitted, you can always change your answers. And just yeah, I think that's it.
Yeah, I think that's right. Yeah, we've got a couple more questions in here, Gabriela.
Yep, let me see.
So from El Khidir Abdel Rasul, if there are more than one MFIs working under one alliance, can they apply under the name of the alliance? So I guess that's like a network. Go ahead.
Yeah, well, I see, Daniel, you want to reply because I see you're typing an answer, so unmute yourself and reply directly.
I was in the middle of typing it, yes.
Yeah. Daniel, do you want to take that?
Sure. So this is a bit similar to the question that I think Promujer asked at the beginning. And so there are two cases you should be aware of. So in the event that the network itself is headquartered in a non-eligible country, so for example in the US or EU, then the application has to be from one of the network subsidiaries that are in an eligible country, right? So that is required. And but if the network is based itself in an eligible country, and that can happen, we've definitely had applications where, for example, a single entity is operating in 4 different countries in the region, then it's perfectly fine for the network to apply. But what's critical is that the applicant has to be in itself in an eligible country. That's the requirement.
Thanks, Daniel. Perfect.
Mm-hmm.
Yeah.
We've got an interesting eligibility question here from Jana on, in order to be eligible, the program must directly provide or facilitate access to healthcare. I am a financial law organization. Will we be eligible if we're in partnership with a healthcare organization whereby I provide financial and tech access to the healthcare organization? Gabriela?
You can go ahead.
No, go ahead. I mean, it really depends. The answer, I think, is prima facie yes. It depends on what financial and tech access means. Are you providing sort of wholesale finance to pharmacies, for example? We probably need to know a little bit more information to say definitively yes on that. But if you are facilitating access, there is financial services, whether it's retail directly to clients or to businesses. If you are, then I think the answer is yes. We'd need to know a little bit more, and that would become clear. Gabriela, do you want to add anything, or should we?
No, I think with the information we have here, Jana, I would say yes, but as Sam says, if you would like to send me an email with the specific case, or we can say it's a definite yes, it seems like it is, but happy to exchange with you if you want, or if you want to open the mic and explain more, or send me an email. But in principle, it looks like, yes, you are eligible, but just to be 100% sure, send me an email and we can continue the conversation. But looks like yes. So yeah. Okay.
Sheila, again, from the Philippines, is there a particular agreement or waiver required for our partners to sign if they're part of our documentation from your end, or will we make our own waiver to give us permission to consent or conform? Yeah. Gabriela?
Yeah, there is no particular agreement with the partners, so you would need to agree with them on what you can include. As I say, we use the information you provide in the application form for mainly for some communications and for these publications Sam mentioned at the very beginning, especially if you make it to the top 10, you will be featured there. So just be sure to tell us if in your application you are sharing something that is confidential or that the partner doesn't want it to be published. Do let me know, and we will take it into account. No problems. We have never had an issue with confidential information being released in the past. So you just need to let us know.
Great.
Okay. Maybe it's not bad, Sam, if we briefly refer to the outreach indicators, because I see there are no questions, but maybe it's because people haven't reached that question yet in the application form.
Sure.
And just to be clear, and I would like to make one thing clear, so I'm going to share my screen again and show you that question just to be sure. So as Sam explained, we ask for some indicators on the outreach of the program. Please note, we have provided, because we expect very different programs to apply and types of institutions, we have kept this question open for you to choose the indicators that best represent the outreach of your program. Here, keep in mind, we need to have an idea of the scale you have. This is what we want to know. So there is a document that you can download that where we provide some examples, but I just want to make clear, these are examples. If you are tracking other indicators, please provide your indicators. Just be sure that with the information you provide, we can have a good idea of your project, how big it is, how many clients are you targeting, how many end clients, in case you are with a partner and it's the partner who is actually giving, let's say, the financial and non-financial services, etc. Note that you can add roads, so it's not that you have only 3. If you have 6 indicators, just click on add road and it adds. If it's a mistake, you can delete the row. I think it's important, yes, because maybe this question can be a bit, in case it is confusing, again, contact me, we can discuss. But yes, don't feel obliged to use the indicators we provide as examples. These are really examples, and please feel free to use your indicators.
And just to expand on what Gabriela said earlier, while that's up on the screen, you see the text that's in the gray shaded area on the right. We've gone to great efforts to try to create explanatory text that makes this as simple as possible. It's in nobody's interest for the application process to be onerous or daunting or complicated. So we think that that text should give sufficient guidance of what we're looking to, but please do read that text. It will help you. It will also help you to focus on the key points that are going to best help. But by all means, email or get in touch with us, and we're always able to email you one-on-one if you have any questions that aren't covered there.
Mm-hmm. Yeah.
Any more questions from anybody who's with us? It sounds like maybe not. You've got if you haven't seen them already, you've got the materials in the chat. They've been posted. Also, the dedicated email address for the award, which is emaward@emfp.eu. And there's the website, which you'll be familiar with, the European-Microfinance-Award.com. But please do get in touch. The round 1 closes on the at midnight at the end of the 13th of April. That's midnight Central European time. So there's another 3 roughly weeks to go. And we wish all of you the very best of luck in this, and please do apply. This is a great award, and if you speak to some of the names we've seen have been involved in previous years' awards, but if you talk to organizations that have taken part in this, you'll see that it's a great benefit, particularly if your initiative can proceed to the later stages. So we wish you well, and if there are no more questions from anyone, then we'll sign off, and we hope to hear from you in the next 3 weeks. So thanks, everyone.
Thank you.
Thanks. Bye-bye.
Bye.